Hello, Dr. Sheng. I'm a Harvard-trained and board-certified medical doctor specializing in spine and pain. If you are still having back pain or shooting leg pain from a herniated disc in the spine, it may be due to a very important reason. In this video, I will teach you about just what happens during a disc herniation and why understanding what we call the natural history of disease is critical for your healing. Importantly, here we are talking about the consequences of an acute disc herniation. Chronic back issues may occur from wear and tear over time to the discs, also called degenerative disc disease. Although there is some overlap with acute disc herniation, degenerative disc disease is not the focus of this video. We have 3 points to go over today: spinal anatomy, the natural history of disc herniation, and what that natural history means for you. Let's begin with understanding a bit of spinal anatomy. Anatomic variations and history of lumbar surgeries aside, you have 23 intervertebral discs in your body. 6 on your cervical spine, 12 are in the thoracic area, and 5 are in the lumbar spine or the low back area. For today, let's focus on the lumbar spine. As the name suggests, intervertebral or between vertebra tells us that the disc is between two bones or vertebral bodies. Now, between the vertebral body and the disc itself is another layer of cartilage that provides important nutrients for the disc itself. The disc has an outer fibrous ring and an inner jelly-like substance called the nucleus pulposus. Now let's talk about the natural history of disc disease. What is natural history? This is a term used to describe how a disease behaves from start to finish, and also how that impacts the person it affects from start to finish. Now, this is a complex set of medical observations that give us a general framework of how to understand a disease. A medical doctor can individualize this understanding for you. Let's talk about disc herniation in the lumbar spine. Discs can undergo many different changes in their shape. When the disc shape moves outside of its normal location, but the fibrous ring is intact, we call this a disc displacement or disc bulge. When the inner jelly-like material leaves the disc space, this is called a herniated nucleus pulposus. A disc herniation may refer to either a disc bulge or a herniated nucleus pulposus. If any of the disc material touches or inflames a nerve or multiple nerves, this can cause pain that travels down the legs. Technically, this is called radiculitis, but a general term often used is sciatica. As someone that sees this day in and day out, back and or leg pain from a disc herniation can be so challenging and debilitating. Here's the good news. Nearly 90% of patients are able to get through this without surgical intervention. MRI studies of patients over time demonstrate that the disc bulge can be cleared by the body on average over 3 to 6 months, but some patients need it up to a year from the initial injury. The speed of resorption does appear to be correlated to the shape of the disc, the size of the disc, and whether or not the nucleus pulposus leaks out or not. Now, what's key here is that we are talking about MRI improvement and not improvement in how someone is feeling. Some folks have a massive disc herniation, but are able to walk and carry out normal activities with some discomfort. But others with much smaller herniations on their MRI are in so much pain that they can't get out of bed. The fact is, there's only a loose correlation between the size of the disc and how much pain or loss of function someone is having. Now, after a disc herniation, it can take up to 6 to 12 weeks just to see any significant important improvement. There are some important take-home points from this data that we just presented. Number one, if you're still struggling with pain and loss of function, it can be an issue with where you are on the timeline of healing. It may be too soon, or you are not progressing as you should, and something needs to change. Please consult your medical doctor. Number two, you are getting better, but still need to focus on secondary prevention or preventing re-injury as you are trying to recover fully from the first one. Let's say a doctor recommends a spinal injection, and after receiving one, it is very effective for pain. Even though you are feeling better, the body still needs time to clear that disc, and you are still in a vulnerable period of increased risk. It is still important to understand the mechanism that led to the injury in the first place and the steps to optimize spine health. Importantly, the natural history can change. With proper education, pain management, spine physiotherapy, and healthy lifestyle changes, you can get better faster. Furthermore, you can even influence the natural history of future diseases as you become healthier and less prone to injury. Conversely, the timeline may reset if the initial problem worsens or new injuries develop. Well, thank you for watching this video, and I hope you found it useful. As always, I wish you health and good guidance in your journey.